Good afternoon, and welcome to today's program titled Protect the Safety and Well-Being of Your Staff and Patients. My name is Jeff Connick with PSQH, and I will be your MC for today's event. Our program today will be 60 minutes in length. Note that an on-demand version of this program will be available approximately one day after the completion of this live program and can be accessed using the same login link that you accessed using today's live program. Today's program is sponsored by Vocera. Thank you to our sponsor and to you and our audience for giving us your time and attention. Before we get started, we have a few housekeeping details. First, to ensure that you can see all of the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. Second, you will find a resources list for today's webinar in the upper right portion of your screen. Here we have listed the webinar slide deck and other valuable resources for you to interact with. Third, at the bottom of your console are multiple widgets you can use during the event. To submit a question during the program, please click on the Q&A widget. It may already be open and appear on the lower left side of your screen. Keep in mind that you may submit questions at any time during the presentation. However, please note that it is likely that your questions will not be answered until the Q&A portion of the program at the end. Finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. At this time, it is my pleasure to introduce our host for the webinar, Kathy English, Chief Marketing Officer for Vocera. Kathy, the audience is yours.
Thank you so much, Jeff, and welcome everybody. Thank you for joining today. Again, I'm Kathy English, the Chief Marketing Officer at Vocera, and I will be facilitating this very important discussion today. We anticipate we're going to have a very lively discussion. We will discuss some really pressing issues out there during this webinar, including workplace violence, the COVID-19 pandemic, and cognitive overload and capacity. Joining me and leading us in this discussion are Vocera CEO Brent Lang.
Hello, everyone.
Go ahead, Brent. We'll also have our Chief Nursing Officer, Dr. Rhonda Collins.
Hi, Kathy. Hello, everyone.
And our Chief Medical Officer, Dr. Bridget Duffy.
Hi, everyone. Thanks for joining this important conversation.
The backbone of facilitating patient movement quickly and safely through a hospital or a health system is communication. And as the COVID-19 pandemic surges, safety concerns for both patients and staff also increase. Efficient and safe throughput will be more important than ever. From clearing the ED and triage areas to managing isolation, ICU capacity and expansion, bed access, and patient discharge, throughput becomes critical and life-saving. Vocera is uniquely positioned to support healthcare organizations during emergencies like the COVID-19 pandemic. Not only do we have hands-free communication devices, but these devices function under personal protective equipment, which you may hear of referred to as PPE. We can create unique groups and workflows that allow care teams and caregivers, whether on the front line, in the ED, in triage tents, or remote care teams, manage and route patients and communicate to external teams. So, to get the dialogue started, we're going to ask you for your participation in a polling question. In a moment, you'll see the question and potential answers pop up. You can select as many as are applicable to your situation. The question goes, thinking about enabling care teams to cope with patient surges and stay protected against COVID-19, which of the following do you see as the most important things to enable care teams to do? Again, you can pick as many as you want, and I'll give you a few moments to enter your information. Choices are communicate bed availability to support throughput, communicate while wearing PPE, communicate efficiently with a group, for example, infection control, locate people who are more distributed than usual, aka a triage tent, or connect with people who are working from home, as many of us are doing today. And then, last but not least, keep communication devices clean. I'll give you just about another 10 seconds, and then we'll go over to the results. All right, let's take a look at the results. So panelists, let's scroll through this and see what our audience had to say to us today. Wow, there's a lot of good answers here. I wonder, would you mind commenting on the results? Perhaps, Brent, you can talk first.
Yeah, thanks, Kathy. It's not surprising to me that some of these jumped out at the top of the list, particularly communicating while wearing PPE and communicating efficiently with a group. We really view the communication technology as part of the personal protective equipment, the PPE. You know, it's not enough just to have a gown or a mask. You really have to have a lifeline to be able to communicate with the other team members. And we believe that the communications technology is really part of the PPE, and so I'm not surprised that this is coming up as an important example. You know, group communication is also core, and oftentimes in these very high risk and high volatile environments, the specific roles and participation of different groups changes on a constant basis. So it's really hard to keep track of who's involved in which group. And so one of the things that the Vocera technology is really good at is keeping track of those role responsibilities and enabling people to reach someone without necessarily knowing their name or their phone number, but simply calling them based on their functional role or responsibility.
Well, thank you, Brent. That's an interesting perspective. Dr. Collins or Dr. Duffy, would you like to make any comments on the results before we move on to the discussion?
I think that some of the concerns that we see are employees having to remove their PPE frequently to come in and out to communicate, to frequently have to clean communication devices, and the fact that we have a solution that can be worn effectively under the PPE gown. The isolation gown makes it a really preferred solution to a couple of things: keep the employee safer, ensure that communication process stays in place, and three, and most importantly, is that they don't have to remove their PPE and replace it as frequently, because the device can remain protected under the gown and enable that hands-free communication that really enables them to stay present in the moment and just continue through doing what they're doing.
Thank you, Dr. Collins. You know, that was a great answer to the question I was just going to ask you. So the results certainly speak to what is top of mind for everyone and where Vocera can help. Are there any other, Dr. Collins, are there any other things we need to think about that would put a nurse or a physician at risk in the continuum of care during this COVID-19 crisis?
Yes, you know, people access healthcare at a time when they're ill, and they're not always in the best temperament or frame of mind, especially now where anxiety is very, very high across the country, both for the healthcare workers and for the patients and their families, of the issue of not knowing or being concerned. So moving them quickly through the system, reducing delays between patients and communication with their caregivers becomes a paramount issue. It eases the distress for the patient. It eases the workload for the healthcare workers to be able to move these patients efficiently through the system. That can sometimes contribute to patients acting out or being aggressive toward the healthcare workers. We can also ensure that the nurses and doctors or workers remain safe and protected, both from the integrity of their PPE and the ability to call for urgent help without having to break their line of defense against something as contagious as the virus we're dealing with right now. So I think those are some of the things that we look at is, you know, we have a patient population that is even more anxiety or more anxious than in the past. We have healthcare workers who are stretched to the maximum of their capability in delivering the care. And communication, again, is what ties the string around everything and keeps everyone functioning together.
And Kathy, I would just add that, during the 20-year history of Vocera, we've had a number of situations where we were asked to respond to emergency situations, whether that was hurricanes or fires or other natural disasters. Communication becomes central to being able to deal with those crises. And one of the things that oftentimes is overlooked is the fact that cell phone towers very quickly become overloaded in these crisis situations. We saw this back in 2007 when the Hennepin County Bridge collapsed. Similarly, when Hurricane Katrina hit on the eastern shore, even the California wildfires, people assumed that they were going to be able to use their cell phones for communication. And they very quickly realized that with the onslaught of all the callers trying to get on at the same time, the cell towers became overwhelmed. And on top of that, the changing roles and the dynamic situation made it very difficult to get a hold of the appropriate person. One of the things that was really special about Vocera and our ability to help out in situations was that because we operate over the Wi-Fi infrastructure, we were able to continue to operate as normal, regardless of the amount of call volume or the impact on the cell towers. So I remember vividly the CEO of Hennepin County Hospital wearing his Vocera badge while he was on CNN being interviewed about the bridge collapse. And I can remember Halifax Health in Florida, when they were responding to the hurricane, they had set up temporary tents out in their parking lot to deal with a large increase in the influx of the number of patients that came in. They were very easily able to set up a Wi-Fi access point and use their Vocera communication system in order to communicate and coordinate care across those different users. So I think it's not just about making sure that we've got the tools in place to deliver care, but also the tools in place to make sure that the caregivers are able to communicate with each other and keep the system flowing freely, even when the cell phone towers may be out of service.
That's amazing, Brent. I think about what's happening today with a number of situations that are like Halifax Health, and it's not just one, it's all across the nation. Amazing. Dr. Duffy, for you, a patient is tested for COVID-19 and a notification is sent from the lab to the electronic health record. What is the risk if that notification is not pushed to the patient's nurse or the infection control team immediately?
Well, Kathy, I think this is what everyone on the phone is dealing right now. They're either in the middle of a surge or they're preparing for the surge. And my brother's in the front lines in Seattle. The need to receive the right information at the right time to the right person is critical. So the ability to have a test sent to the right person so that they can notify and move patients either into an isolation room or out of one if the test is negative is critical as people are trying to find extra beds, makeshift rooms in hotels, etc. The other issue is often these patients, my colleagues are sharing with me, have atypical presentation to the emergency room. Several patients are showing up and they think it's a cardiac patient with chest pain, women showing up appear to be in labor, and infectious disease consults are being ordered. So there's a way to be able to quickly through the electronic record get this to the right person to come do the consult, to order a test, and rapidly get the result back. And unlike the two cases that my colleagues experienced, the patient spent 3 to 4 days in the hospital and ended up being positive, infecting cath lab and other areas. So right now it is really imperative that the information gets from the emergency room, the electronic medical records, through a communication system to the right person so that we can protect our staff in the trenches and get the patient into the right room.
Thank you, Dr. Duffy. That's critical in terms of timeliness. I mean, the fewer people that are exposed, the less the epidemic becomes crisis-oriented. Thank you. Okay, so let's move on. In times of high stress, anxiety, or crisis, when emotions are elevated, it's critical to safeguard healthcare workers. And with the COVID-19 crisis, there's a chance we will see more violence in our hospitals. Our workplace violence is already 4 times more likely to happen in hospitals than in the private sector. And we have found that in healthcare environments, there's a higher incidence of intentional injury by another person, more than in police protection or correctional institutional settings. Our research has shown that 1 in 4 nurses has been assaulted. At least 58 hospital workers died between 2011 and 2016. And National Nurses United call this an epidemic of violence. You may have heard about Elise Wilson, who is a nurse in Massachusetts. And during a routine assessment, the patient punched her in the head and stabbed her 11 times. And while she was in the hospital recovering from 8 hours of surgery, Massachusetts lawmakers drafted Elise's law. This law is designed to protect nurses throughout the state from workplace violence. Before we move into this topic, we want to engage you again and do another polling question. So we'll, in a moment again, see the choice list of answers that you can respond to with this question. Please make your selections and choose as many as you like that are applicable to your situation. And the question is, what is your organization doing to address workplace violence? We have a number of answers here to select from. The first being strict visitor protocols, especially during this COVID-19 crisis. Panic button in patient rooms. A mobile panic button worn by the staff. Metal detectors at the hospital entrance. Perhaps communication protocols with local police. Or maybe the answer is none. Workplace violence is not an issue at your facility. Let's wait a couple moments to let you have a chance to enter your results. Again, check as many as are applicable to your environment. We'll wait about another 10 seconds. All right, how about if we take a look at those results and see what you have to say? Oh my goodness. Well, I probably have a comment here, but I would much rather have our panel comment on the results that you've given us. Perhaps, Brent, you could go first.
Yeah, it's really interesting. I'm not surprised by the visitor protocols. Let me just comment on the protocols with local police. This is something that we've seen become more and more common with our customer base. In fact, if you look at SUNY, State University of New York, they were able to implement a protocol where they were able to call the local police to bring them to the emergency department through their Vocera communication system, and they were able to reduce the amount of time it took for that communication to take place very substantially. They reduced the amount of time almost by half. So I think that bringing in the entire community and local law enforcement as well as local security teams becomes a very important one. One that I'm actually surprised is not getting more focus, and maybe it's just because it hasn't more fully penetrated, is the panic buttons. We're seeing an increased interest in panic buttons worn by staff members. And when we were designing the new Smart Badge, we actually created a dedicated button on the side of the Smart Badge that allows for clinicians to instantly get help by pushing on the little red panic button that opens up an audio channel to other caregivers who are in the area and to a predefined panic group as well as members of security, so they could hear what was going on in the room and bring help as needed.
Wow, Brent, that's amazing. Dr. Duffy? Or was that Rhonda? Dr. Collins?
It's Rhonda. I was going to say that one of the challenges I think that addresses the strict visitor protocols, of course, is having these very ill patients who cannot have their family members with them, which adds to the stress and the confusion of the time. we've actually seen some hospitals affix a Vocera wearable device directly to the bed that enables the care team then to communicate without putting on and taking off PPE, but to actually stand at a window or a door and have conversation with the patient. And then with our ability to record, report at change of shift, and through our Vocera Care experience to allow the caregivers to record that information that then can be sent to the family member. The family member can access that through a link that they can actually listen and validate that the information is correct, because as we all know, when we are doing our assessments and taking histories of patients, frequently it's the family that is giving us the most accurate information, or making sure that we're on track with our assessment and our information. So our goal is, even during these times, to utilize the ability to use technology that doesn't require hands when we're in the patient care environment, because our goal is to keep communication devices away from the face, allow it to seamlessly link the patient and the caregivers together, whether that's respiratory therapists, nurses, physicians, the entire team caring for that patient. And so we've become very innovative, and especially with pop-up beds and in places that may not have traditional nurse call or anything like that. With very little changes in the technology workflow, we're able to then enable a badge for the patient affixed to the bed directly to the caregivers who have the wearable under their PPE, or enabling them to remain outside the room and reduce the number of changes to their PPE.
Thank you, Dr. Collins. It's interesting. I was watching an interview by someone last night on the news, and it was a woman who was admitted through the ED with COVID-19, and she said the entire time she was in the hospital, she felt alone and lonely.
Mm-hmm.
Dr. Duffy?
I was just going to add, I'm really struck by the communication outside the walls of your institution, the need for that historically with violence and connecting with police, but in a COVID era, we've had several health systems ask us, can you connect us through your hands-free technology to the local public health or the disaster preparedness team, or to other regional hospitals, so that we can help each other during the surge and don't have to be, searching for, phone numbers. So I'm intrigued about the ability to not only connect to police or National Guard to keep your facility and your people safe, but to be able to report cases or get help back and forth. And we have the ability to do that. I'm also, the humanity of this and the COVID virus, of the strict protocol of no family there, and the ability for, patients to have to call in. I have a colleague who's a pulmonary critical care doc, just put on a vent in Sonoma 2 days ago, but his wife has to call the desk. They have to go find the nurse. She then has to don her PPE. She then has to go in the room and hold the phone next to his head. But there are other or better ways, as Rhonda was just mentioning, that with the strict visitor protocol, we can lessen the anxiety and the frustration from family members who can't see their loved ones by enabling communication much more easy and not interrupting the nurse's day.
That's amazing, Dr. Duffy. Thank you for that comment. So we're going to move back into the panel discussion, although this has already been a very lively discussion on just addressing the results from the panel question. Workplace violence can have a ripple effect across an organization. And now that we're in the middle of this pandemic that's stressing our care teams and society, beyond the acute harm caused by a violent incident, how does workplace violence affect employees as well as patient care and safety? Perhaps, Brent, you could address that first, and then maybe Dr. Duffy and Dr. Collins.
Sure. We're clearly already in a time of heightened anxiety with everything that's going on. And I think the additional fear of isolation and the fear of violence within the workplace can compound that anxiety. One of the things that I think is critical is to create some sort of communication lifeline for the care providers. As was referenced earlier, they can feel very isolated or unable to reach other colleagues and support infrastructure. And so providing communication capabilities that creates not only a support for their work, but also for their social well-being and emotional well-being is absolutely critical. We also mentioned the panic button capability. Something that allows them to reach out and work with other employees is absolutely critical in these difficult times.
That makes sense.
And
Dr.
Kathy,
Duffy?
yeah, so the emergency room, historically has had the highest incidence of workplace violence along with behavioral health, and now it's the first point of entry for patients with the surge with COVID worries and diagnosis. So I think it even, I used to walk out the door to work every day and say to my husband, please don't let me harm anyone, and now it's the other way around. I think, doctors and nurses aides and respiratory therapists are working at the peak of their competence and their humanity, but their lives are at risk from the virus, but also from upset family members who are being stripped away. So I think, as Brent said, this is a really important time for them to have instant connectivity to their team members for help and to security should the need arise in a hands-free way that keeps them safe with their PPE.
Makes sense, yes. Dr. Collins?
I don't think I could be any more eloquent than Bridget and Brent have been, so I will leave it there.
Okay, all right. So I have another question. We've all seen the line of cars of folks waiting in their COVID-19 diagnostic test line. We've seen historically long wait times in the ED, which can be a risk factor for violent incidents. Dr. Collins, how can Vocera technology help reduce ED wait times and perhaps help mitigate this risk?
Again, I think we touched on it several times, is just in really enabling the workflow, and workflow is enabled by communication. I think that it's being able to connect the different teams that are managing the increase or influx of patients through the system, determining who goes in what door, if doors have been reserved for isolation, but to enable everyone to be on the same platforms, talking in the same nomenclature with the same expectations, really streamlines that entire process. And really, once you've streamlined the process and you're moving patients through the system, the agitation level goes down significantly. I've been in very busy EDs that really were the size of a football field. And it was the quietest room I've ever been in a hospital, and it was simply because everyone was enabled with communication devices that were directly on their person. The reduction of shouting and overhead paging, there was none of that, which happens all the time when we just need help and no one is hearing or seeing us. We have to shout for help. So being able to enable those communication devices just right in the moment where you are, and I frequently say there's nothing mobile about a mobile device except the wearer or the user. And so we enable those people to be able to do their job and take their communication with them.
Yes, I can't imagine how noisy it is right now in these situations with people anxious and
oh my goodness,
to get in touch with one another. We found that
absolutely.
Noise levels can really lead to higher levels of agitation and violence. Dr. Duffy, did you want to add anything to? Or go ahead, Dr. Collins.
I'm so sorry. That's another thing I was going to say. Sometimes people change, shift changes, and we are not able to stay aware of who's moving in and out of the care teams. And that's another thing that we enable, is not having to know names or numbers. We can just call for triage nurse on call, and it will contact whoever is in that role at that moment in time. So those are just some of the things I failed to say that and wanted to bring that up.
Mm-hmm. Well, I can imagine that quiet would help with a healing environment. Dr. Duffy, did you want to add anything around that concept?
Sure. But I just want to tag on to what my colleague, Dr. Collins, has said to me, in previous conversations is, as a nurse or doctor, simplify my life. Give me technology that works the way I do. Don't make it more complex. And, she said that to me before, COVID-19, and it's even more imperative now. And just the burden before with cognitive overload and alerts and alarms, fatigue, this is even heightened on steroids beyond anything we could imagine. So from a nursing perspective, we need to do things that take things off their plate and get the right alerts and alarms to the right person at the right time, but keeping them safe. And from a patient's perspective, one patient said to me, if I can't sleep, I can't heal. And if they can't sleep, they're more agitated, patients in the ICU, sundown. So I think the opportunity that we have is to try to just minimize the overhead pages, the alerts, the alarms, and just take things off people's plates today is important now more than ever in the history of being in healthcare.
Yes, I wholeheartedly agree. And I know, Brent, you talked earlier about a couple health system examples about how processes and protocols have helped to mitigate violence. But I wonder if there's anything else you might want to add. When a patient incident does occur, how can technology help safeguard hospital staff, visitors, and patients?
Yeah, thanks, Kathy. I mean, it all becomes about getting help there as quickly as possible. And I mentioned the case study from SUNY Upstate Medical University earlier, where they were able to drive average response times from public safety officers from about 3 minutes to just about 1 minute after implementing the Vocera system. This was really done by creating a direct link from the Vocera system through the phone network out to the local law enforcement and public safety officers. We had a similar case study at Toronto East General Hospital, which is now known as Michael Garron Hospital up in Toronto. And they created an integration between the Vocera badge and their security officers. And as a result of that direct integration, they were able to reduce the amount of time to get someone to the scene of an incident from an average of about 2.5 minutes to less than a minute. So these solutions are fairly straightforward. They're fairly easy to implement. It's really about creating the appropriate workflows and the appropriate connectivity, and then training people on how to use the tools. And that extra minute or so can make a huge amount of difference in the safety and how badly a situation can escalate out of control.
I wholeheartedly concur. All righty. Thank you so much, Brent. So chaotic and unpredictable work environments can take a toll on clinicians. And with growing concerns around the coronavirus, now more than ever, we must protect the mental and emotional well-being of our care teams and find ways to reduce their cognitive burden and support their capacity to care. When dealing with the emotional toil of their own health and family worry, too many alerts, alarm notifications, messages, and calls from multiple people and systems can really overwhelm and interrupt nurses and doctors. We know this can lead to cognitive overload. And studies have shown that cognitive overload is a cause of 80% of medical device user errors, and more than 250,000 people die each year from medical errors. We must protect our care teams to ensure their well-being and the well-being and safety of patients. So participants, we'd like to ask your opinion again. We have a new poll question. This will be our third question in this webinar. And as before, you'll see a question and a list of choices where you can select all that apply. Please make your selections in the answers, in the little check boxes there next to the answers. We'll take a few moments to let you think about it, and again, I'll read the question. What is contributing to cognitive overload at your organization? Could it be complex clinical workflows and processes? Perhaps siloed clinical and operational workflows and processes? Could it be planning and preparations for COVID-19? Or all of the above? Or actually none of the above? Perhaps cognitive overload is not a problem within your health system. I'll give you about 10 more seconds to answer. And again, please check all that apply so that we can get your real answers and everyone's opinion. All right, let's take a look at the results. So, Dr. Collins, you've spoken around the world about cognitive burden and its implications on clinicians. Can you share with us the signs and symptoms of cognitive overload and how it impacts patient safety? And perhaps can you incorporate your thinking as it relates to the answers that we're seeing here in the polling question, because there are some significant results here and priorities.
Yeah, that's right, Kathy. Thank you. You know, cognitive burden is something that really manifests based on short-term memory and how folks can load and process information. One of the things that definitely affects cognitive burden is our own personal world that we're living in. And I would say right now, for those healthcare professionals coming to work, there's this constant nagging at, will I be exposed? Will I expose my family? You know, fatigue, all of those things play into it. So cognitive burden is manifested by forgetfulness primarily, and lack of sleep, errors both of omission and commission, and definitely an impaired emotional response. All of those things can lead to mistakes, bottom line. And patients are always impacted when our professional staff are working past the limits of their mental capacity. So what I always recommend, you know, when we see and we start evaluating and our workers are overcome with a situation that is actually feels quite uncontrollable, that we give them tools that allow them to control the immediacy of their environment. We allow technology to carry that burden of memory for them. So there's not this constant circling back and validating, circling back and validating. And one of the things that we have committed to at Vocera is with our software is to put all information in the context of the patient. So if I get a lab value, I don't have to frantically look and make sure it's associated with Mr. Smith or Mrs. Jones. It comes in the context of the patient. I can have the diagnosis and also in the context of the care team. I can add care team members and reduce care team members from my communication. I can text, I can call, and always with the background software of I don't have to know a name. I just need to know a role that they're in, so I can say call cardiologist on call for 5 West, or whoever is in that role then will give, the message will go directly to them. And we see so many times when I interview nurses or nurse leaders and they talk about, I just need to be able to reduce the anxiety of not knowing for my care team. The nagging concern of breached PPE is always a concern. And one thing I would state is that communication devices should be considered a mandatory part of PPE. Just like Brent said earlier, like your mask, your gloves, you have to have a communication device to be able to reduce the time of not having to clean a phone or not having to clean any other kind of communication device every time you walk out of the room, and to be able to keep it secure against your body underneath the isolation gown reduces that nagging worry of putting something to your face dozens and dozens of times a day. So I think when we talk about reducing cognitive burden, it's always about what can we allow technology to carry? Can we allow technology to carry the burden of memory? Can it carry the burden of a call list? Can it carry the burden of connecting teams? And can it carry the burden of connecting critical information with the exact patient that it needs to be connected to? So I think that is really when there's a whole lot to talk about with cognitive burden, but right now in this urgent place where we are in our country with really just an unprecedented situation, we need to ensure that our caregivers have the tools that they need to provide the care that they need to provide in the safest, most effective way possible.
I wholeheartedly agree, Dr. Collins. It's scary times right now, and we want to make sure that those important people at the front line are as resilient as they can be. Mm-hmm. Let's move on to the discussion a little further. Dr. Duffy, as clinicians navigate complex workflows, system regulations, and other pressures like the COVID-19 pandemic, how can human-centered technology take these things off their plate so they can have more capacity for caring?
Well, I think today people are at maximum capacity and nobody has the time to sit at a computer and try to pull data out. Everyone is running from patient to patient, from unit to unit. And so what's needed now is the ability to have human-human connection and to reach their colleagues when they need to, and to receive the right data at the right time with the context around their patient in their hands. As people are in makeshift hotels and tents, as we talked about earlier, it's really important that, and as our technology does, it integrates with over 150 other systems so that the data can come to the right person at the right time to ease the burden. But more importantly, I think hands-free voice technology enables human-to-human connection. And when you're in a battlefield like we are right now, it's like a lifeline to your colleagues to be able to ask for help when you're overwhelmed in the emergency room, or to be able to say what's happening with the patient and can I get help in this room when you're in your PPE and you don't want to come out and take your PPE off, which is, as Rhonda said, the greatest risk for exposure. I think now more than ever is the need to keep people safe with hands-free under their protective wear, but just to enable people across campuses to be able to talk to each other when they need to get to that person quickly.
Makes total sense. Brent, are there other ways Vocera Solutions specifically can help hospitals and health systems support care team well-being and perhaps create ideal healing and working environments?
I would start by just reinforcing what Bridget just said. I think the comment that she made about connecting to others as a lifeline to other team members is the core of what communication is all about. But there are some really important other benefits, some of which we've touched on briefly. You know, the ability to reduce the amount of noise in the hospital environment can certainly improve healing. We've found through studies of using our product that the amount of noise in these environments is reduced substantially by eliminating overhead paging, by eliminating alerts and alarms that may be unnecessary, and by directing the communication from one person to another, so that can actually have a dramatic impact on noise levels, which in turn impacts the healing abilities. We talked about the panic button as a way of improving the work environment and creating more safety. But there's two others that I want to touch on briefly. One is the ability to create a code lavender. Code lavender is the idea of reaching out to other colleagues and care providers in times of great need, or potentially when someone has suffered a loss, and just take a moment for emotional and spiritual healing. From the Vocera system, from either the Vocera badge or from your application on your smartphone, you can actually just do a code lavender, and it sends a message out to a predefined group of people who can help with that emotional and spiritual healing process and just kind of take a moment to restore and rejuvenate the care providers. We've also implemented the ability to actually play a short meditation right from your Vocera badge. You can play a 5 or 10-minute meditation. If your time and your schedule allows it, it would walk you through just a short meditation process that allows you to restore your mental health and recenter yourself before going back into fighting on the front lines. I remember a conversation I had with a manager of medical telemetry at Halifax, and she just talked about the fact that before they implemented Vocera, she was exhausted by 10 o'clock in the morning, and it was just running around looking for people, looking for equipment, trying to get the help that she needed. And having the lifeline of connectivity to other care providers really allowed her to be more effective in doing her job, and also preserved her energy for doing the direct patient care as opposed to being interrupted by all the other distractions and friction that gets created within the healthcare system.
You know, Brent, that's an amazing point. In fact, we call code lavenders at our corporate office all the time for staff that are going through difficult times. And we leverage our own technology to do that, which is just so cool. Has tremendous impact on well-being of our staff as well. So folks, these are unprecedented times. You know, everybody's saying that, but it truly, truly is. This conversation around keeping our patients, families, and care teams safe in the face of this pandemic and every day has really been amazing. Thank you to our Vocera leadership team for your wisdom and insight. And audience, we're going to open up the floor to your questions. So please take a moment to enter your questions into the Q&A portion of the platform, and I'll ask as many of them as I can to our panelists so that we can have a high impact for you with this webinar. So let me take a look at the questions. I think the first one is for you, Dr. Duffy. It says, what are you hearing from CEOs and other hospital leaders about what they need to support clinicians and care teams on the front line?
Well, we're talking daily with many who are calling us to see how we can help them outfit their makeshift units. One has turned their ambulatory clinics into 1,000 potential rooms preparing for the surge that has not hit yet. But in addition to the basic things that the whole world cares about right now, like respirators and masks and PPE, the two other things that they're focused on is just instant connectivity to their care team. One CEO said, we have a rapid response COVID team of my leadership in 6 tiers. And every single day, he said, we can no longer round or huddle together like we used to. And he said, we're having difficulty connecting because there's 40,000 of us, you know, several working from home, and the cell towers go down, Skype has gone down. And he said, so what I really need your help with is how can you connect my team and help me cascade the communication rapidly that needs to happen? And second, what they're talking about is how do they support the emotional and physical well-being of their people in the trenches, which is heart-wrenching to watch. As one colleague shared, we're colleagues intubating other colleagues, and it's very difficult to deal with that. So every CEO is caring about the emotional, spiritual, physical well-being, but also protecting their staff.
Wow. Okay. Next question. Dr. Collins, this is for you. Can this device be used in the OR, and is it capable to transmit through the radiation walls?
It's Wi-Fi based, so absolutely the OR is a really productive and unique place for Vocera to be, to connect those teams, to keep OR turnover happening and moving. It can certainly be used. We can recognize privacy to respect HIPAA. by allowing earbuds. We can do Bluetooth or connected earbuds or ear communication devices. And we really do function in those very high areas like ED, OR, NICUs, L&D. Those are places where communication is on fast forward, and that is really a place for Vocera.
Thank you, Dr. Collins. It's interesting that you mentioned the earbud because there is another question about that, and it says, does the Vocera device use an...
Yeah.
I know. It says, does the Vocera device use an earbud, or how is communication provided to stay compliant with HIPAA initiatives?
Well, I mean, we can use an earbud. We have two different styles of the wearable badge. The newer smart badge actually, in a place where you're not worried about putting something to your face, and just in a patient care environment, you can unclip it and just tap a button, much like on your smartphone, that turns it into a little phone, that headset that you can put up to your ears. You can do that with both badges, but it seems to move just a hair of a second quicker with the smart badge. But absolutely, we've made that deliberately, so if conversations happen while the wearable's in place, we do a lot of teaching about protocols. If you are absolutely in isolation and you need to keep that badge under the gown, to just be able to say, I've got you, Kathy, can you give me 5 minutes and I will call you right back. And that way it protects the patient you're with and the patient you will be discussing.
That's cool. And can you use it with both wired and wireless headsets?
Yes. Yes, you can. We have some recommendations on that, but you certainly can.
Okay, so this is an interesting one. This communication device seems to be a great avenue in the event a coworker becomes violent secondary to heightened anxiety with all hospital personnel. So it's not really a question, but it's just reinforcing what we've been talking about during this whole webinar.
Mm-hmm. Mm-hmm.
Let's see.
Yeah.
There is a question that's an interesting one as it relates to the Vocera product line. What recommendations do you have for home care? And I know, Dr. Collins, we've had some discussions around that recently with one of our customers.
Mm-hmm. We sure have. We do. We have customers in a very rural state who utilize Vocera on cellular. Now the wearable is unique to Wi-Fi, but to be able to put the app on a phone enables the hospital home health organization to function and be able to use all of those same features I talked about in the software, that not knowing who's on call, or so say you're going into the home of a patient who's been discharged from the hospital, but you're not sure who the hospitalist is working today, you can just say, call hospitalist on call, and that way you can access the information, validate orders, do whatever you need to do. So we already have in place functioning and supporting hospital at home or home care, or however you want to describe that, with full capabilities of communication, features in the software, and back to the hospital.
That's great. And I know that our CEO, Brent Lang, would love to answer this question. Is the communication device voice activated? And also, is it expensive?
So the answer to the first part of the question is yes, it can be voice activated. So all the interaction with the badge is done using voice commands. So for example, I could say, call Dr. Collins, or I could call someone based on a role or a group. So I could say, call the nurse for room 103, or I could say, broadcast to the emergency response team, or broadcast to the OR turnover team. Those would all be voice commands that we've spoken to the would be spoken to the badge, and then it would interpret that command and would set up the call so you could have a live conversation. With our Vocera badge, the original Vocera badge, you did have to push a button on the front of the badge in order to initiate a call. But with the new smart badge, we've now implemented the Hey Vocera functionality. And with Hey Vocera, you can be entirely hands-free. So you actually don't have to touch the device at all. The device listens for that hot word or that key command of Hey Vocera. And once it's heard that, it will respond back with the prompt allowing you to issue other voice commands, whether that's calling an individual or broadcasting to a group of people or recording a message for an individual care provider or for an entire group of people. And so in that environment, it becomes entirely hands-free and becomes voice-activated as well as voice-controlled. And we're really excited about that new functionality, particularly with the importance of hands-free capability in today's environment where people are oftentimes wearing the Vocera badges underneath their protective gowns and sterilization gear. It becomes even more critical.
Thank you, Brent. I want to be respectful of people's time. I know everyone is so busy these days, and we're getting close to the top of the hour. So I would like to say thank you to all of you in our audience. Thank you to our executive team and our presenters and panelists. And I wish you all well and hope that this has helped you to gain more insight to how we can help in this pandemic. Jeff, back to you.
Thank you, Kathy. I would like to say on behalf of PSQH as well, thank you to all of our presenters, to Vocera for putting on such a program, and most importantly to our audience for participating with us today. We know your time is very valuable right now, and we appreciate all that you're doing. And so this will conclude today's presentation. Thank you again, and we hope that you'll join us in the future for additional PSQH webinars.